another tip for the examination is familiarize yourselves with the document. Where will you find the document? If you haven't seen the document, it's on the website, okay? Let's say if you book your examination in Oxford Brookes, it's there. If you book your examination in Northumbria, in Northampton, in Leeds, in Northern Ireland, just go to their website. You will see the documents in there, okay? Just so you know that all the documents in the Osce is similar across test centers. Always remember the ones who's creating the examination, the NMC and Alpha Plus. So all the marking criteria are the same across test centers. Probably like one test center will release the marking criteria earlier than the others. Okay. So that is it. So again, Emer, where can we find practice materials? If you check their website, you go to the mock examination. The mock examination document contains sample documents of the exam. Okay, so if you're doing adult nursing, you go to the link. If you're doing mental health nursing, you go to their link. If you're doing nursing associate, mental health, midwifery, you go to the appropriate link. So you will find the appropriate document on the examination. So what are the documents? We have the news, we have the GCS, we have the must, you have the PHQ9 and other documents related on your examination. Make sure you familiarize with those documents. Because of course, can you imagine on the examination, you turn up and then they've given you a document you've never seen before. So you have to say your prayers and take a deep breath. So you don't want to go there and then you discovered, what is this document, assessor? I've never seen this before. So you have to say your prayers and you have to take a deep breath. Okay? But hopefully that will not happen in the examination. Next is remember to complete the appropriate documentation in all required station. Guys, probably in my years of teaching the OSCE, the most reason of fails on the examination is because of not documenting properly. Okay, a lot of nurses failed the examination because of not completing the documentation. Let's say the news is incomplete. There is no blood pressure. There is no news score. There is no frequency of monitoring. Let's say for the care plan, there is no signature. That normally for implementation station, there is no omission code. Can you imagine for care plan? You've written the best care plan ever, but you did not sign it. That will automatically result to a fail. Okay? Always remember that. So on the examination, my tip for you guys, once they hand over or once they give you the documents, so you have to locate on the areas which you need to sign. Normally for care plan, let's say for care plan, sign the document immediately so you won't forget it. Okay, so you won't forget it. But it doesn't apply for medication because of course you cannot sign the medication if you haven't given it yet. Okay, normally you can start with writing your name. Okay, normally for papers there is a slot for a candidate name, so you have to write your name there immediately so you won't forget it. We don't want to fail because of not writing your name, not writing the date, not writing the time. You need to follow the marking criteria. Okay? Some of the criteria on the examination are not in order. For the people who've been practicing their skills, sometimes the criteria doesn't make sense. Do you agree with me? Sometimes you need to perform criteria number 3 first or criteria number 4 first. Okay? So I think some of you are agreeing with me with that aspect. The most important thing is you have to perform all criteria. It doesn't matter how are you going to do it in order. Okay? Of course, you cannot sign the document without giving the medication. That's obvious. Okay, that's common sense. But again, there are some parts of the criteria we're in. Probably you need to do number 2 first before number 3. Okay? But of course, it's impossible to do number 9 before number 1. Okay? Let's say, how can you give the medication if you haven't prepared the equipment? Yeah? I hope that makes sense. Yeah? So if you've been practicing your OSCE, you can relate with what I'm saying. But again, it all boils down to, if it's not written on the marking criteria, it's not needed. Okay? If it's written on the marking criteria, you have to perform it. Got it? So that means, if you recall your marking criteria, not all scenarios require identity check, which leads me back to my previous slides. You have to listen to your assessor. Okay? You have to listen to your assessor before you start the station. Sometimes they will tell you, you've done the check, you've identified that this is your correct patient, okay? That you've checked the date, the allergy, and that's it. Just prepare your equipment and perform the skill, okay? They are telling you to save your time. No need to do it again, okay? Because again, you are just wasting your time if you will be doing it again. But always remember, if it tells you on the marking criteria, check the identity, you have to check it. Okay, got it? The golden rule is normally stations which require you, a skill station which requires you to give a medication, it's automatic. You have to check the identity. Yeah. If we recall, let's say IM, subcut, AIM, the VIP, all those, you need to check the patient's identity and some of the stations as well. Okay. So tonight, try to revisit the marking criteria. If it's there, you have to perform it. If it's not there, it's not needed. Okay. So there's a question from Anne. What happens if you will not do all the marking criteria or miss 1, 2 items? So that means it's a fail. Most especially if you missed a crucial part of the criteria. Always remember, guys, on the examination, the assessor will be holding the same paper you are reviewing. I think this will be my best tip for the examination. Just stay calm. You know this, but I had to say this. You need to be calm on the examination, okay? You need to control the nerves on the examination. So most of the, can you imagine? I'll give you a story, okay? Let's say, what if your first station is BLS and you think after doing that, you messed up, okay? You need to calm down before proceeding to the next station. Because can you imagine, you have 10 stations to perform and you messed up on the first station. What will happen with the 9 remaining stations? You need to collect yourself. You need to take a deep breath, pause, and move on. Okay? This is a time wherein you have to move on. There's no 3-month rule. Okay, on the examination. You really need to move on. Normally, guys, on the examination, there is like a pause in between station. Okay, let's say you finish your BLS. The assessor would ask you if you want to go to the toilet or if you want to drink some water. Okay, grab that opportunity to collect yourself. Yeah. So in between station, again, your examination will last for 3 hours. Can you imagine? It's a long examination. It's 3 hours because in between stations, you can take a rest. Of course, the rest will not last for an hour. Yeah. Just like 2 or 3 minutes. So you can go to the toilet or drink some water. If you think you messed up, try to grab the time to collect yourself and redeem yourself. Again, it's better to to fail one station than all the stations. Yeah, is that correct? We don't want to fail 5 stations or 9 stations. And it happens. Yeah, believe me, it happens in the examination. Take a deep breath. Because the more, let's say, you think, let's say, in the middle of your examination, you messed up and then you realize it was wrong. You panicked. What will be the tendency? You will be committing more errors. Okay? If you panic, you will be committing more errors, more reasons to fail. Okay, so on the examination, if you committed a mistake, take a deep breath, relax, and verbalize to your examiner that a mistake was committed. Okay, so again, if the mistake is not crucial, you might still pass. But of course, if the mistake is a grave mistake, of course, they cannot overturn the result.